Hello, everyone. We are Team 2, and we will be presenting on the 1957-1958 H2N2 influenza pandemic. Next slide. The 1957-1958 influenza pandemic, also called the Asian flu, originated in China and caused an estimated 1 million to 2 million deaths worldwide. The strain of the virus that caused the pandemic was influenza A subtype H2N2, a recombination of the avian flu and human influenza. It was a novel strain of the virus, so there was low immunity in the population. Like COVID-19, there were large variations in the symptoms from person to person. Some people only experienced a mild fever and cough, while others had life-threatening complications like pneumonia. The rapid development of the vaccine against the H2N2 virus and the availability of antibiotics to treat secondary infections limited the spread and the mortality of this pandemic. This was the second major influenza outbreak in the 20th century. Next slide. This is a map showing the spread of the H2N2 virus made by the Johns Hopkins School of Public Health. The first cases of the virus were detected in early 1957 in China, as shown here in red. The first recorded outbreak occurred in Hong Kong in April 1957 and spread to many other parts of East Asia, shown in purple. It reached the United States in June of 1957, as shown in blue. Next slide. These are two popular images associated with the 1957 pandemic. The first picture is of Charlotte Silverman, the chief of the Division of Epidemiology and Communicable Diseases for the Maryland Department of Health. She helped create informative videos about how to prevent the spread of the disease that was circulated around the city of Baltimore. This had great success in limiting the outbreak in Baltimore and around Maryland. The second image is of Joseph Ballinger, a doctor giving the first vaccine in the state of New York to a nurse named Marjorie Hill. With the reminder of the last devastating flu pandemic in 1918, the CDC asked 6 vaccine manufacturers to make the vaccine as quickly as possible, which helped limit the mortality of this disease. Next slide.
In the beginning of 1957, the influenza A, or H2N2 virus, arose in East Asia. The virus originated from strands of the avian influenza and the human influenza viruses. Since the virus was a variation of much more upscale level flu, the symptoms were still common flu-like symptoms. However, symptoms among people with the H2N2 virus varied in severity. Some patients experienced minor cough and fever, while other patients experienced life-threatening conditions such as pneumonia. Commonly known as the Asian flu, the first cases appeared in Guizhou, China, in the late 1956. This didn't become a reported case until February of 1957, as well as outbreaks in Singapore and other neighboring countries. The H2N2 virus then spread to Hong Kong by the following April, and then by the end of May, the second influenza pandemic of the 20th century was upon us. The 1918 influenza pandemic was more extreme in the number of cases and the mortality rate. However, the effects of the H2N2 were devastating as well. In June of 1957, the pandemic reached the United Kingdom, and India had a total of 1 million cases. Within the same month, the virus slowly spread through the United States, where relatively few people were infected initially. A few months later, the virus spread rapidly throughout the United States until the first peak in October. Next slide, please. The first wave was predominantly in children, rather than the second wave being in the elderly. In July, a vaccine for the virus entered the trials and was available to the United Kingdom within the same month. As everything was expected to get better, an unfortunate second wave of the illness infected a large number of the elderly population. By March of 1958, there was an estimated total of 69,800 deaths that occurred in the United States. The number of cases as well as death continued to increase throughout the middle of the 1958. The H2N2 virus was responsible for a series of annual epidemics for the next 10 years, which initially led to the 1968 pandemic. Next slide, please.
This slide is meant to give an idea of how many people were at risk for the virus. So the slideshow, I wanted to present pretty much, the overall population, which was about 2.8 billion people, was the overall, but in the United States was only 177 million. So the 1957-58 influenza, also known as the Asian flu, it started off in Guizhou, China, but the residents of that area there was only about 6,000 people in that immediate area. So we talk about the dangerousness of people being infected in high populated areas such as New York, and with the current pandemic being in China, this shows that there is a correlation with being a high populated area and the prevalence of disease in that area for the 1957 Asian flu, and now for our current pandemic of COVID-19. At the time of the incident, China's population was about 635 million people. For the size of the country and its rapid population of growth, this could be very dangerous if that disease were to keep on growing throughout their nation. Next slide. So this slide is meant to just give an idea of how bad the event was. For the world, suffered about 1.1 million people, but this number is also estimated to be between 1.1 million to 2 million people that died overall. For the United States, the number of people estimated to die is about 117,000 deaths. This number is also varied to 150. I've also seen staggering numbers up to 200,000 deaths. So like I said, similarly to COVID-19, those who are more susceptible already had weakened immune systems, primarily respiratory issues. So the morbidity of this was primarily set on respiratory illnesses. So people who already had asthma were at more at risk of getting this and actually dying from it. We actually have there was clear evidence to show that for the COVID-19 pandemic that's going on right now, as the same for the 1957 Asian flu. Another association for the COVID-19 was how the symptoms progress from being no symptoms or being mild symptoms to having a fever and a cough. Well, the worst case symptoms came from those who were diagnosed with pneumonia, which for the cause of their death ended up being complications of pneumonia or flu. So the comparison with other influenza pandemics, this graph is meant to, next slide. This graph is meant to show basically an overview of the other flu pandemics that have gone on. And I actually seen a lot about this, a lot of references about this, where they actually describe that a lot of pandemics usually happen in Asian countries. And that also starts a lot of criticisms and a lot of scrutiny to Asian countries. For that minority in our country, they will receive that scrutiny, which is a social determinant. And I think that it should play a significant role with our current White House, with our current president, putting that scrutiny on other minorities within the country, as well as China overseas. Next slide, please.
So this was the first pandemic that was, each member states of the WHO had developed comprehensive pandemic plans describing the public health measures to be taken. and they collectively aimed at reducing illness and fatalities. And for the first time, pandemic vaccines were developed, produced, and deployed in multiple countries during the first year of this pandemic. Vaccine production efforts were greatly accelerated, and the US received its first influenza specimens from Hong Kong on May 13th and definitively identified the new strain on May 22nd. Special efforts were made to rapidly adapt the vaccine for use in vaccine production. Eventually, vaccine effectiveness was found to range from 53 to 60% in studies conducted during the outbreak. But given the limited amount of vaccine availability and the fact that it was not more than 60% effective, it is apparent the vaccine had no appreciable effect on the trend of the pandemic. In the United States, CDC's only available measure for assessing epidemiological trends in the US was through routine weekly telegraphic reports on deaths coded as pneumonia or influenza. The data was regularly reported to the National Office of Vital Statistics, and these reports, which were received from 108 large cities, were found to lag the actual death time by about 10 days and the date of onset of illness by about 3 weeks. An influenza surveillance unit was established at the CDC in July, and the following 3 additional surveillance systems were added: county reporting, national health surveying, and absenteeism. Association of State and Territorial Health Officers encouraged home care for uncomplicated influenza cases to reduce the hospital burden and recommended limitations on hospital admission to the sickest patients. In terms of risk communication, which is the exchange of real-time information between experts and people facing threats to their health, the Asian flu was the first pandemic to occur in an environment with a global surveillance system and laboratories capable in place to study it. Americans were advised to limit hospital admissions to the sickest patients only and encouraged home care to not overwhelm healthcare resources. Interventions generally did not take place, such as closing schools, restricting travel, closing borders, or recommending wearing masks in public. And quarantine procedures at this time were considered inappropriate given that the symptoms were not very severe. Largely, this was a mild influenza, and symptoms of it were clearly made to the public along with what they can do to help mitigate the illness at home.
So after finally going through everything, did we actually learn anything from this pandemic, and did we put new measures forward? Yes. So we learned that rapid vaccine development helps in pandemics. Not that we didn't already know that, but we kind of saw that happening with this pandemic. So as said earlier, they had six manufacturers working together nonstop to help develop this vaccine and get it out to the market. And that helped. And so now what's happening with that is H2N2, the strand of this flu, actually went through a series of antigenic drifts over the years. And so drifts are just small changes to the antigens. And then it went through a big antigenic shift in the 1960s, which is what led to the 1968 pandemic right there. So with that, they actually do keep some strains of the H2N2, being built in labs and coddled in labs. So that way, if we do have another strain of this pop up as a pandemic, we can quickly have a vaccine ready to go before, honestly, it hits pandemic levels. So that's one thing we learned, and we're still currently in the process of doing right now. We also learned that the effectiveness of vaccines is super important. Not only is it important to actually get a vaccine out, and it's kind of similar to what we're doing today, we need to make sure our vaccine is effective. So the vaccine that was effective, that was made at the time, was only 46 to 60% effective. So still pretty good, but not like total immunity. And it came a little bit too late. It came at the end of the second wave, and only 17% of the population took it. But again, it's better than nothing, and it really did help kind of curb that last little bit and settle it into nothingness. Also, something that we learned helped a bunch is something we're working with now, trying to find drugs that will help treat the secondary infections, because a lot of times with the flu and other things, you'll get pneumonia or you'll get some other infection, and so antibiotics specifically were used to treat the pneumonia that patients had, and that helped people recover, so you aren't struggling with two things, you're only struggling with one. And as we fast forward into the future, experts in 2009 looked back at this pandemic to try and figure out how to do the H1N1 pandemic, because a lot of the things were similar. It started on a small locally and then spread, but also at the same time, it wasn't world stopping per se because the symptoms were mild. You can't seem to do the quotes, but were mild in terms of pandemic symptoms. So they were looking at whether or not we should social distance, quarantine people, or how to make sure hospitals had room for people. And that is what we learned from this pandemic. Thank you for listening. Here's the sources.